All right, good morning everyone. We've recorded 14 new cases overnight, but in good news, all of those cases are linked and 13 of them were in quarantine for their entire infectious period. Just one, was unknowingly infectious in the community for a very short period of time and is considered a low risk. So thank you to those people. They've done the right thing. And by doing the right thing, they've made a big difference to our public health response. And if we get more days like this, it is very encouraging that our lockdown is working and that we're able to control the spread of the virus. We have 9 people, though, now hospitalised with COVID-19. Some do have pre-existing conditions. And as I mentioned yesterday, one person remains in intensive care in critical condition. And again, we extend our love to that person's family and our thanks to the staff in the intensive care unit for the care that they're providing. Yesterday, 5,964 tests were conducted in the ACT. And the reports are this morning that waiting times across our many testing centres are quite low. In terms of vaccination, there continues to be around 4,000 first and second doses of vaccines administered every day in Canberra. So just over 37% of our population aged 12 years and older now have received both doses of the vaccine. Registrations for 16 to 29-year-olds that we opened a few days ago for the Pfizer vaccine through an ACT government clinic have now reached over 20,000 in those few days. So thank you to the 16 to 29-year-olds who are the single biggest cohort of Canberrans who have come forward to register for their vaccination. Of course, if you want to jump that queue, the AstraZeneca vaccination is already available and you can walk in today and get vaccinated through a GP or pharmacist. Now, the ACT government continues to prepare for the more widespread vaccination of 12 to 15-year-olds. This will be a topic of discussion at tomorrow's National Cabinet, but we are already well advanced in our planning for the vaccination of 12 to 15-year-olds. And as I've mentioned before, they are eligible to be vaccinated and so they will be included in our 70 and 80% thresholds. Right now, vulnerable Canberrans aged 12 to 15 years of age, those who have underlying health conditions, have already been prioritised for Pfizer vaccination. Now, as has been discussed locally and nationally, the vaccination rate, and that increasing day by day, is absolutely critical to the public health response here in Canberra and around Australia. But as we know, we have a limited supply of Pfizer, so we are still some months away from reaching the 80% targets that are contained within the national plan. As I've mentioned before, vaccination doesn't stop at 80%. We need to keep on striving for more and more vaccination coverage. And the ACT government's goal is to see well above 80% vaccination coverage for our population. And the signs are very encouraging that we will achieve that. And to Canberrans aged 70 and over, you're at more than 95% first dose coverage. So that shows what's possible. And it now really is up to Canberrans under the age of 70 to get up towards those levels of vaccination. And we'll do all we can to support you to get vaccinated. That's your protection, it's your family's protection, and it's our community's protection against what's coming later in the year. So I need to be clear that for the next several months, the entirety of spring, very careful management is going to be necessary. Very careful management of the transmission potential of the virus in our community. Our vaccination rates, whilst nation leading, are still not sufficient. And so we have a very delicate balancing act over the next 3 months to step out safely of lockdown, gently, as the epidemiology allows, but still protecting our community against the risk of the virus coming back in and sparking another outbreak. That's what we will be seeking to balance. And so vaccination and early vaccination is so critical now. There remains a high degree of uncertainty about what we're going to face locally and what will play out around us in New South Wales and across the nation. So as much as I would like to give absolute certainty on particular dates, we simply can't. We don't know what's going to transpire. All we can do is plan and prepare and reduce risk. And that's exactly what we're focused on. Spring is going to be difficult. Here in New South Wales, where they've just ratcheted up to over 1,000 new cases today, and it's going to be difficult across Australia. But as we have always done, we will listen to the public health advice, seek to enact that fairly, and balance the risks across our community. And that's our approach. It always has been, and it always will be. Now, as I noted yesterday, the lockdown will not be ending early. Chief Health Officer will be briefing our Cabinet this afternoon. She'll be briefing us on possible future public health settings. Any changes will be announced tomorrow. But I can say, as I've been saying throughout, that will not be a significant easing of restrictions. It will be a gentle step forward. And this will remain the case through spring. We're not going to be in a position, given our vaccination rates and all that is transpiring around us, to go back to being where we were prior to this outbreak. It will be gentle steps forward until the nation reaches those key vaccination targets. The ACT will reach them first, we think, if we continue our current efforts, and that will provide us with protection when the nation eventually opens up more fully in the summer. What we need to do now is restrict the interaction between people as much as possible. We do this to reduce the transmission potential. As I've said before, and the evidence supports this in terms of our outbreak and what we're seeing around Australia and around the world, if you get infected, you will bring the virus home, and everyone in your household who isn't fully vaccinated will get infected. We're also seeing a lot of workplace transmission. So if you get infected, it's likely that you will infect close work colleagues. And they too will take the virus home and infect their household and infect other close work colleagues. And that is how you go from one case to hundreds of cases to thousands of cases, as we have seen playing out just over the border in New South Wales. So further decisions beyond our current scheduled end to the lockdown on the 2nd of September, will be considered by the Chief Health Officer next week. So we'll meet this afternoon, we'll get the advice, we'll make announcements tomorrow, and then we'll consider the future beyond the 2nd of September next week. Today sees the Business Support Grant Scheme open for applications, and they're already coming in. The ACT Online Business Hub has more details on the nature of support available, the guidelines for that support, and your capacity to apply and to receive that support. Applications will be processed as quickly as possible, and the quality of the application, the detail of the information that is provided, will assist those who are assessing the applications to make quick decisions and to get the payments to businesses. But as I mentioned yesterday, we are highly alert to scammers. These similar schemes in other states and territories have seen people try to scam the system. We're working hard to avoid that because we want the money to go to the businesses that need it. If you're unable to earn an income during this period, you should be able to access payments through Services Australia's COVID disaster payment. We continue to encourage the Commonwealth Government to broaden access to this payment to younger people and to certain visa classes that are currently excluded. Before I close, can I also thank union and industry stakeholders across many different industry sectors who have been engaging with the government, working through the fine details of COVID-safe arrangements that are applicable for their industry sectors and representing their members, be they workers or employers, very effectively. This engagement is really important for the government to be able to make well-informed decisions. And I want to thank each of the unions and industry associations who've been engaging with government over the last 10 days. In conclusion, we recorded 14 cases, all of them linked, and only one infectious in the community for a very short period of time and considered a low risk. But as we step through each day of the lockdown, we are seeing more people needing hospital care, and that number is now at 9, and 1 remains in intensive care in critical condition. I'll now invite the Deputy Chief Health Officer, Dr. Johnston, to provide a further update on cases and epidemiology, and then the Minister for Health, Rachel Stephen-Smith, will provide an update. Then we will take questions, and if yesterday is anything to go by, who knows where that journey will take us. Dr. Johnston.
Thank you, Chief. I'm Dr. Vanessa Johnston, ACT Deputy Chief Health Officer. So, as the Chief Minister has said, since our update yesterday, the ACT has recorded 14 new COVID-19 cases, with the total active cases associated with this outbreak now standing at 190. Of these new cases today, I can confirm that out of the 14 can be linked, 100% can be linked to known cases or ongoing clusters. We know that 12 of the 14 are household contacts, and the remaining 2 come from existing clusters. Out of the 14, 13 were in quarantine for their whole infectious period, therefore posing no risk to the community, and only 1 was unknowingly infectious in the community for at least part of their infectious period, and this is considered low risk. Unfortunately, we now have 9 cases in hospital. 1 of those is in ICU and is requiring breathing support. Since our last update, we have just under 7,000 self-identified close contacts and over 4,300 casual contacts. We now have over 420 exposure locations spread across the ACT. So please stay up to date with these exposure locations frequently on the ACT Health webpage. Now to provide a broader update on the outbreak. At this time, there is very little change in the breakdown of active cases across the different age groups. So these are 38% of our cases in people aged 0 to 17 years, 46% in people aged 18 to 44 years, 12% of cases are aged 45 to 64 years, and 4% are over 65. I'm pleased to advise that there have been no additional cases linked to the disability cluster or the Bright Bees Early Learning Centre overnight. Our public sites of transmission remain at 10, and so again, please check the exposure sites on our website If you've been to any of these sites that I'm going to read out now, during the dates and times identified, please get tested. So we have the Bright Bees Early Learning Centre, Nichols, at 11. We have CIT Reed at 2. Gold Creek School at 2. Downer Community Centre at 13. Fiction Nightclub at 33. Assembly, the People's Pub at 4. Lennox Jaguar Land Rover Dealership 15. Lynham High School 41. Belconnen Basketball Stadium 7. Southern Cross Basketball 34. I'd like to thank everyone again for their ongoing patience as we work through our close contacts that are coming to the end of their quarantine period. And I'll reiterate again today that you need to remain, you must remain in quarantine until you've had a negative test result on day 12 or 13 of your quarantine period and you've been contacted by ACT Health. For any assistance or advice in relation to this, please call the COVID response team on the COVID hotline, which is available on the website. So today, my shout out is for our wonderful exemptions team. This team continues to work literally day and night on processing exemption applications, predominantly now from New South Wales, but from other jurisdictions when they also go into lockdown and we declare them a COVID-affected area, as Victoria is now. So, as an example, they have received close to 20,500 applications for an exemption to enter the ACT from New South Wales since June 2021. Many of those people are essential workers, they're applying for compassionate reasons, and the exemption team does an amazing job in dealing with them all in a very timely, kind and compassionate manner, and I really thank them for their work. Thank you.
Thanks very much, Vanessa. I'm Rachel Stephen-Smith, the ACT Minister for Health. So I've got some good news today. The first piece of good news is that there are currently no wait times across many of our testing sites at the moment. So if you are due to undertake your day 12 or 13 exit test for being in quarantine, or if you have even the mildest symptoms of COVID-19, now is an excellent time for you to go out and get tested. It is incredibly important that we maintain that level of surveillance of testing right across our community. So we continue to encourage anyone with even the mildest of symptoms to please go and get tested. Thank you. I also want to provide an update on the aged care sector in the ACT. And the good news here is that there have been no new cases connected to the Greenway Views Village. We continue to have health staff on site providing support to the village. The Commonwealth has also advised us today that 82% of residential aged care staff across the ACT have now received at least one dose of COVID-19 vaccination. This is a significant improvement in our vaccination coverage for aged care staff. Over the last 2 weeks, if memory served me correctly, we've gone from 44% to 66% to 82% of aged care staff having had a first dose of vaccine. So this is an outstanding result and of course comes ahead of vaccines, a first dose of vaccine at least becoming mandatory for aged care staff from the 17th of September. I'd like to thank all of those staff for the tremendous work that they are doing in our aged care facilities at what is a very difficult and stressful time for them and for residents and families, particularly during lockdown when visitors are not allowed. I'm encouraging remaining aged care workers to come forward urgently for vaccination. The Commonwealth and the ACT Government have been working hard to make vaccinations as accessible as possible for aged care staff, and this is being shown in our numbers. But getting vaccinated against COVID-19 will protect you, will protect your family, and will protect those people who you care for every day. Some further good news from the University of Canberra Hospital. All the close contacts to the positive case have been tested and have returned a negative result but all, of course, remain in quarantine as close contacts. As an additional precautionary measure, the team decided to test all patients at the University of Canberra Hospital. So the Canberra Health Services Infectious Diseases team has assessed the risk of transmission as being low. Patients, their families and carers have been provided with an information sheet and a contact telephone number where they can seek further information. And again, I want to thank staff, patients, families and carers for their understanding and cooperation at this difficult time. But the team is absolutely assuring me that the risk to patients is very low and the testing is a precautionary measure that I understand has been well received by patients. And finally from me today, before I hand back to the Chief Minister, I want to note that today is day 14 of quarantine for thousands of people in our community, where their last potential exposure day was Thursday the 12th of August, the day before we went into lockdown. I want to thank all of those people who have been quarantining for the last 2 weeks. Whether you're a close contact or a secondary household contact, quarantining is not easy. Thank you very, very much for doing this to protect the wider community from COVID-19. And as Dr. Johnston has said, if you are a close contact and you have received a negative test result but haven't yet heard from ACT Health about your release from quarantine, there is a phone number you can call. We do ask that you are patient. The team is obviously getting through thousands and thousands of people on this last day of quarantine for so many. But if you do need to call, the number is 5124 6500, and you can select option 5 if you're in that group of people who's waiting for advice about release from quarantine. And just another note on that, as we have been being asked, secondary household contacts will not be contacted separately by ACT Health. So if the close contact in your household is released from quarantine, you are also released from quarantine as a secondary household contact. You will not receive a separate communication from ACT Health. So with that, I will hand back to the Chief Minister for questions. Thank you.
Thank you very much, Rachel. We'll start on this side of the room.
Chief Minister, on the day that New South Wales has recorded its first daily total above 1,000, it's announced that there'll be certain privileges for double-dosed vaccinated adults. Could you see that or a similar scheme being part of a gentle step forward in the ACT's move away from lockdown?
Look, I've heard a little about New South Wales' position. I think they announced it at 11. An extra hour in a park or something was what the Premier said. We'll make our own local decisions based on the epidemiology here. I mean, we're clearly not in a position, because of our effective management, of facing 1,000 new cases a day in Canberra, or even the population proportionate version of that. As to the broad principle of will there be certain extra privileges granted to vaccinated people, that's the subject of some national discussion through the National Cabinet as to what that might look like in the future. We still face the challenge, though, that not everyone who wants to get vaccinated can get vaccinated at the moment. So I think that's a discussion around privileges for vaccinated people that is best had when everyone's had the opportunity to get vaccinated. And that will certainly will come a time when this is a very valid and legitimate discussion to have. But right now our focus is on supporting people to get vaccinated and to protecting the unvaccinated over the next 3-month period.
So you don't see that being used at all in the spring period?
I'm not ruling anything in or out, and certainly things that were announced an hour ago at a New South Wales press conference deserve a little bit more scrutiny and consideration than a response from me 75 minutes later. We'll have a look at a range of options, but I stand by the initial point I made that it really right now is about getting more people vaccinated and supporting that, rather than extending privileges to people who have been lucky enough to have access to a vaccine. One of the reasons we are in the situation we are in now is that we didn't have enough vaccines early enough. And so we've been playing catch up ever since.
To give us some insight into your decision-making process over the next 24 hours, how significant will be the extension of the New South Wales regional lockdown to your decision? Should Canberrans expect there could be a circumstance where the restrictions here would be significantly different to those in surrounding regional New South Wales?
Well, I guess the first point gives another layer of comfort that what I've consistently observed about the New South Wales approach has been to move more quickly and in a more effective way in the regions than they did in Sydney initially. So you can interpret that as learning from the mistake of not going hard and early in Sydney. They've not repeated that mistake in the regions. So that is, yes, that's an important factor in our consideration. As to where we go beyond that, we need to consider the epidemiology, the local circumstances. But I mean, no one's doing this for fun. No one wants to be in this position. But what we need to do over the next 3 months is buy the time that the unvaccinated need to get vaccinated. And the unvaccinated at the moment is 60% of Canberrans over 12 years of age. That's a lot of people. It's a lot of people we're protecting. That's a lot of mums, dads, brothers and sisters, kids, aunts and uncles, cousins, friends, work colleagues. It's a lot of people we've got to protect. And that's what the next 3 months is about. But the best way you can get protection is to get vaccinated.
Chief Minister, noting that there are a lot of workplace infections at the moment, and there's a growing push from business for mandatory vaccination in some shape or form. Do you support businesses going down that path, such as the Canberra Airport has announced this morning?
Yeah. Well, look, I strongly support business encouraging their staff to get vaccinated, facilitating their staff to get vaccinated, supporting their staff to get vaccinated. The mandatory element is difficult when there are some people who still can't access a vaccine. So, again, I think there's a time for this debate, but we're not quite there yet. But what will make it easier and clearly provide protection for employees and safer workplaces that are responsibilities of employers is if more people are vaccinated. So I think we can lean in very heavily just to encouraging, supporting and enabling without quite yet getting to the discussion about whether it's mandatory in every business setting. We've got a couple of high-risk settings where a decision has been made to go down that path. But right now, let's just focus on getting more people vaccinated.
So just to follow up, so if a cafe, for instance, demands proof of vaccination from customers, is that something that you would support or not?
Well, it's a complex legal question that has many answers depending on the reasonableness of the vaccination request and the reasonableness in terms of providing a safe workplace or a safe place for customers. Now, I'm not the Commonwealth Solicitor General. I'm not a lawyer by training, so I don't think I'm best placed to provide the detailed legal advice. I note that the Prime Minister has stopped well short of providing legal advice or a government view from the federal government, who do, of course, control the industrial relations legislative framework for the territories and the state of Victoria as a result of a decision of the Kennett government many years ago. So I don't think I'm going to be wading into this space when the Prime Minister isn't prepared to. But what I am prepared to say is that I strongly support businesses supporting their staff to get vaccinated.
Still on businesses, Chief. A lot have been in touch saying they believe they can trade safely with contactless or click and collect. Could we see this happen at some stage? Do you know whether this is among the restrictions being considered?
Well, I won't preempt all of the considerations that we'll have later this afternoon and in the coming weeks, but yes, I can say I am aware, and we've had many good and detailed engagements with individual businesses as well as their representative bodies on how this could be done safely. And so it is under active consideration. We recognise this. We said at the beginning that this 2-week period was very important to be able to control the spread of the outbreak. That the purpose of a lockdown is to reduce the interaction between people so as to reduce the potential for the virus to spread. Every decision that eases that and sees more interaction and more movement of people slightly increases the risk. So the question is what level of risk are we prepared to take? We have to make some very difficult decisions to balance that. But the counter position here is that if we take too much risk and allow too much activity, then case numbers will increase again and we have to go back into a lockdown, and a hard lockdown. And we're going to be balancing these issues, I suspect, for the entirety of spring.
Canberrans who remain in quarantine are continuing to report they're finding it difficult to have their groceries delivered. Is the ACT government continuing conversations with the large supermarkets, and is the ACT government considering stepping in to provide grocery support to people in quarantine more broadly?
Right. Well, yes, we certainly have been engaging not just with the major players, but across the grocery industry in the ACT, and you've seen some innovative approaches adopted. We do have a program that is being undertaken in partnership with community sector partners to deliver food to the most vulnerable. And we are starting to see the number of people in quarantine starting to reduce as a result of being at this point in the lockdown. So whilst there is nothing that is ever certain in a pandemic, and certainly in an outbreak, it would appear, at least for this phase, that we have reached the peak of the number of people in quarantine, and provided everything else goes well, that number will start to come down.
Chief Minister, on business support, is the well dry in that area? We hear from some medium businesses particularly that perhaps have multiple stores across locations but only one ABN at $10,000, though generous, still probably won't touch the sides. Is it likely that there could be further support for businesses?
Well, we still have a range of further proposals before the Commonwealth Government. You might recall Senator Seselja went out to the media and suggested that we could put forward some more proposals. We did. We're still waiting to hear from the Commonwealth on those. There has been almost daily engagement between my office and Treasurer Frydenberg's office on these matters. Of course, some of our existing structures and decisions have been based on a 3-week lockdown, effectively. If that extended, then yes, there would be an extension of further support.
You've said that you'll try and process these applications as quickly as possible, but of course you're conscious of the possibility of fraud. Can you understand the frustration, though, from some businesses that perhaps these grants should have been ready to go as soon as we went into lockdown, given the warning signs were there before we went into lockdown? Well,
some grants were already underway before we went into lockdown in relation to tourism and accommodation businesses. Unfortunately, the arrangements that the federal government put in place require a bespoke partnership, effectively. So last year they had stood up JobKeeper and there were a range of programs and supports that effectively automatically flowed through payment channels that already existed. That was the most efficient way to deliver support. Now, this year, for a variety of reasons that are entirely decisions that they are entitled to make, they decided to change the way that all of that would work, moving to the disaster payments through Services Australia rather than the JobKeeper arrangements paid through business that effectively kept the employee linked to the business. Now that link is broken, and to access the COVID disaster payments, businesses effectively have to lay off staff, and so that then means the staff are eligible. We have then had to stand up the largest ever grants program in ACT history in order to make payments to 10,000 businesses and to go through an assessment process against a set of criteria that needed to be agreed with the Australian government and needed to have consistency with some of the other state and territory programs. But this sort of has been evolving as each state and territory has gone into lockdown. So the result of all of this is that last year we had one pretty clear, simple national scheme. Now we have a different scheme in each state and territory and a different set of arrangements for employees. It is what it is. There's nothing I can do about that. All we can do is engage in good faith with the Commonwealth to stand up the programs and to get them rolling, which is what we've done.
Another business question. What's your message to business who seem to be increasingly anxious about the lockdown, from construction right through to hospitality? What's your message to them? Hang on. And what about your message to those who possibly can't hang on?
So these are incredibly difficult times. No one wants to be in this position. We are not the only people in Australia or around the world in this position. And there are a range of alternate scenarios that could have played out had we taken a different path in our response. Often government is faced, and this is a great example of it, with no easy choices. And we know that the public health restrictions, the lockdowns that are necessary to stop this ripping through our community and seeing hundreds and hundreds of people really sick and dozens of people dying, the effect of the lockdowns stops that, but it has an impact on businesses' ability to trade, and it dampens demand for many goods and services. And this is a terrible situation for everyone, but we're not going to get out of it unless we work together and that our public health responses are effective. And so our pathway is to try and get the case numbers to largely where they are now, where we can have more days like today when the new cases have been in quarantine and not largely been infectious in the community. That gets us to a better position in that we will have managed the immediate public health crisis. But as I alluded to in my opening remarks, we're going to have to balance this for several more months. We are very conscious of the issues that have been raised with us by the construction sector, by many other industry associations. It's not just about construction. As important as construction is, there is a much bigger economy than just the construction sector. So I acknowledge that. This has impacts on retail, on hospitality, on professional services. You name the area of the economy, there's likely to be an impact. That's very well understood. But the alternate scenario is to have done what New South Wales did, and they're now, 3 months lockdown, 1,000 new cases a day, a health system bursting at the seams, an economic activity that is absolutely flatlined. So we're not doing that. And what we will seek to do as we step through the next 3 months is to, within the risk that we can bear, increase economic activity. But until our community is vaccinated, we cannot return to normal. So to all the businesses, I understand But we've got to do this. We've got to protect our community. And so please get vaccinated. The quicker people get vaccinated, the quicker we can all move forward and things can return to normal.
We've heard today about cases of workplace transmission. Are you able to provide any indication of what kinds of workplaces that's occurring in and whether that information will feed into the decision-making process about allowing some economic activity to return or not?
Sure. Well, and you've seen where the clusters are and where the cases are occurring and where the exposure sites are. They're across a range of different workplace settings. We need only look just up the highway at where transmission has been occurring at a rampant level in Sydney and where big clusters can occur, seemingly in innocuous circumstances at times. So, this is a factor. So I have been listening day after day to the New South Wales Chief Health Officer's updates and what they have been saying about their outbreak that is, in the thousands and thousands and thousands now. So it's a pretty good data set on where the risk transmission potential is. It's pretty clear that once it's brought back into a household, everyone pretty much gets it unless they're vaccinated. And that most close work colleagues are also transmitting the virus to each other. That's just a fact. And we've got to respond to that fact with a set of public health directions that try to minimise that risk whilst also trying to have a level of economic activity.
A question to the Chief Health Officer, if I can.
Okay, if there's no more for me. Nothing on Merimbula? No, okay, thank you.
Doctor, you spoke about the demographics of people that are infected. Are you able to give us an age range, the youngest case and oldest case at this point?
I'll have to get back to you on that. I don't have the current range. I'll have to get back to you on that one. I can only give you the categories, is the only data I have today on that.
You've been hesitant to say the case numbers are showing any trends yet, but are the numbers infectious in the community more reliable? Can you say whether they're trending in the right direction or that there have been few additions of new exposure sites?
Yeah, I think we can be cautiously optimistic that the number of cases that we're now finding in quarantine and the number of cases that are infectious in community are trending the right way. So in quarantine's going up and infectious in community is going down. And I think since the lockdown, most of that exposure in community is in the context of going out to do essential shopping with a mask, so appropriate PPE and short, sharp trips, so really present low risk of transmission. So, we're really encouraged by that. As I said in the press conference yesterday, there are still a number of unlinked cases that we have not been able to link them to a source, so that's always a concern about undetected chains of transmission that might be in the community, which is why the Minister for Health today has so reinforced the need for people to continue to get tested with the mildest of symptoms. Even if they haven't been to an exposure site, it is likely that there is community transmission out there. So that's really critical. But I think the trend is in the right direction.
You spoke on this yesterday as well, but that trend, is that why we're seeing these lesser numbers of exposure sites in each update? Because people aren't out in the community, because more of the cases are linked to family members who are already in quarantine?
Yeah, that's exactly right. That's absolutely right.
Are you able to provide an update of the total number of unlinked cases in the outbreak at the moment?
I tried to get that for you this morning because I had a hunch I'd be asked that. So I don't have a change from 8 yesterday, but I know there's some further source investigation going underway today, which may lead to a revision in that number. So we'll definitely bring that back to you tomorrow, but I don't have an update from yesterday's number that I gave you.
Just how worried are you about what's happening in Sydney with over 1,000 cases a day, and how can Canberra withstand that sort of outbreak just up the road?
Yeah, look, I think it is a real worry, as the Chief Minister has continued to reiterate. It's a worry and it's heartbreaking, quite frankly. I think the good news is that I feel confident that we're going in the right direction with our current outbreak. Certainly the latest mobility data from the Doherty modelling is telling me that the effective reproduction number is way under 1 for us in the ACT. So the lockdown's working and people are abiding by those lockdown measures. So, you know, Canberra really is a ghost town at the moment. People are doing the right thing. So that's going to curb our transmission tremendously. So I think ongoing, though, we're just going to have to continue to have very stringent controls around who comes in from Sydney and risk mitigation measures around that, which we are continuing to do. So, of course, it's a concern to be so close to that epicentre.
Just on testing numbers, are you still confident? I think they were around 5,000. Still confident that those sort of numbers are an accurate reflection of COVID in the community, or would you like to see them significantly higher?
No, I mean, that's the kind of numbers that I'm happy with. I think, again, because we've locked down, we've got less exposure sites. You know, at the beginning, when they were astronomically high numbers we've never seen before, you know, that's not really, A, it's not sustainable, and B, it's not necessary when we don't have so many exposure sites. So now it's really capturing people with symptoms and new contacts. So I'm really happy, but that's not to say that you should not get tested with the mildest of symptoms. You absolutely should. We have to flush out any cases that we don't know of yet.
Are you able to say how many people will be coming out of quarantine in the next day or so? Is it large numbers?
It is large numbers. I can't give you exact numbers, but again, because we are coming up to 2 weeks from the lockdown, and when we had the vast number of exposure sites go up that were all classified as close contact, because this was before we were wearing masks and had restrictions on movement, it's in the order of thousands.
For the Health Minister, if that's okay.
Sure.
Minister, do you have any further update on the Condominium court situation? And we've been hearing that there are some understaffing issues that may contribute to difficulties with managing breaches.
No, I don't think there are staffing issues. This is a complex situation and it is a multi-agency response, and I think the initial response to the notification of the case at Condominium Court and the identification of it as a close contact exposure location was absolutely outstanding in bringing together all of the agencies that needed to be involved and bringing in our community partners and being able to go out, door knock the community, provide information to people about what had happened, the requirements for quarantine, how people would be supported. What I've certainly seen, not just here but around the country over the last 18 months as we've responded, is what tends to happen is you have this very strong immediate response, and then in the next few days, as you start to settle into a longer term response, people will raise different issues. There will be some further conversations about who's doing what in the context of that response. People will have questions. They may not immediately be able to be answered. And those things do, come up as sort of bumps in the road in that really coordinated response. All of those things are being worked through, continue to be worked through, and we'll continue to respond to issues that are raised either by our community partners, by members of the multi-agency team, or by tenants themselves or by other members of the community. So it is a complex situation. There are many different people living in that multi-unit residence, and the team is working really hard to provide a person-centred response that understands the needs of tenants and supports them, as I've said before, to quarantine safely. So more work is happening today to ensure that that multi-agency response continues to be really well coordinated as it settles into a longer response over the next 2 weeks of the quarantine period, as opposed to an immediate response to get support and information to people.
Can you confirm whether or not there have been any breaches or issues with compliance, or you're not aware?
Look, it is a difficult site for there to be maintaining 100% compliance with quarantine, and that's why the work across agencies and with our community partners is so important, to ensure that everybody at Condominium Court, some of whom are people who are quite vulnerable and have very complex lives, are supported to quarantine safely. So yes, I am aware that there are concerns about people not being able to comply with quarantine requirements and do that safely, but we're working very closely, and our multi-agency team is working very closely with that community to provide all the supports that can be put in place to ensure that people are able to undertake their quarantine safely. That's it. Okay, thanks everyone.